Hi all, hope you're well. I'm just setting this up from my end, but nice to see you all. We'll get started shortly. Here he is.
There you go.
Oh, hello, how are you?
That was smooth, wasn't it?
Well, with you the other way round, and then me with no voice. This will be really entertaining, I'm sure.
Yeah,
Yes,
so
with my
that's what
voice is
you get
completely
when you
gone.
hit the karaoke bars to offer Melissa.
No, that is not me at all. Don't know who you're talking about. No, we've had an exceptional day at the Dermalux headquarters today, and I've spoken all day long hosting a meeting, and now my voice has gone as a result of that. So I do apologise, but hopefully, can you hear me clearly? Okay.
Yeah,
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 okay,
all
that's
good.
good. Okay, great. Well, we've had a few people come and join us, so that's great. We'll get started.
Yeah,
Welcome everybody to today's Instagram Live, our latest edition. And I'm really excited to host this topic on pigmentation and exactly what is going on with the skin and the tools that we've got to be able to exceed our clients' expectations. My name is Melissa Williams, and I head up the Dermalux Academy here at Dermalux. And now I would love to introduce the guest that we've got with us today. And I've made a couple of notes, if that's okay, because there's quite a list of things that I think are really important to share here. So the globally renowned aesthetic doctor, the founder of the multi-award-winning Perfect Skin Solutions in Portsmouth, which I've had the pleasure of meeting and visiting you all. The founder of the Perfect Skin Academy, and of course, the founder of the most incredible skincare brand, the new skincare brand Cell Derma, that I am obviously
thank
a
you.
huge fan of, and the most talked about the DF5 serum, which yes, I have to say is one of my favourite products at the moment. So yes, who am I talking about? The incredible Dr. Dev Patel. So thank you so much for joining us today.
Thank you, Melissa.
Yes,
What a
no, it's
lovely introduction. I'll just take you around with me to do my
yes,
intro. That's
well,
great.
you deserve it. And you know, I was worrying about my voice today, and I thought, you know what, no one's here to see me. It's all about you. So we're so lucky to have you on board. So thank you so
Thank you.
much. And so today's session will take about 30 minutes. I think that's what we've
Yeah,
agreed.
yeah,
We're going to have 30 minutes to really look at pigmentation, and we've got some really great questions here that I'm going to go through. But if there is time at the end for questions that come up, then of course we will have that opportunity to answer those as well.
sure.
So let's get stuck in, shall we? I guess the most important question to start with is, what is pigmentation? If you can give us a pigmentation 101, that would be wonderful. You know, what's going on in our skin? What's the causes? You know, what is it looking like? Those kind of things. That would be brilliant.
Yeah, okay. So, well, pigmentation, ultimately, when we're talking about pigment, we're generally talking about melanin, which is the pigment that gives, it's a brown pigment, and it sits in these cells called melanocytes, which we all have. And when you look at, some people may have heard of something called the Fitzpatrick classification system, which is where we type patients' skin. And it's loosely based on color, but not always. So you can sometimes get very fair people, but actually they'll be classed with a higher number. But very typically, if you've got a very fair-skinned individual, that typically they may have quite a lot of freckles because they've sustained a lot of sun damage early on in life. Okay, and they burn easily. They'd be sort of Fitzpatrick 1. And then as you work up the numbers, you get to 6, which is where you've got dark skin, which would be the least likely to burn in the sun, etc. Me, for example, I'm of Indian origin, and I'm 4. Most people would put me as a 4. So we have, so me compared to you, we'll have roughly the same amount of melanocytes, but I've just got more melanin in my melanocytes. And so that gives me my natural pigmentation, which has evolved over centuries. And that's what gives us, as part of our ethnicity, because of where our ancestors lived, so it's protection. So those in, you know, in Scandinavian countries and in Ireland and Scotland and other places, less UV radiation overall. We've just evolved to have less pigment in our skin because we didn't need that protection. In fact, we needed as much vitamin D as we could get from that limited sun. And so we were designed to be fair to get that. When I say we, you. Whereas my ancestors were exposed to a lot more UV radiation. Now, of course, you know, there's a damaging effect. We know that. And so, you know, we've developed over the centuries more melanin in our melanocytes. Now, that's all well and good. That's what we're genetically programmed to have. If you then sustain inflammation, and inflammation, we've all got inflammation day to day. If I'm more stressed today, I'll have more inflammation in my skin. But if inflammation goes up, and that can be from anything, from injury, and that can be from a device that we use in clinic, or it can be from a cut, whatever. Inflammation will usually result in, well, it's certainly an increased risk of us forming pigment. Now, that can be temporary, and we call that post-inflammatory hyperpigmentation, but it can take some time to disappear. The highest risk of getting that is actually in my skin type. So it's not actually in Fitzpatrick 5, 6, actually in 4, particularly India and the surrounding countries. That's the highest risk. But there are other factors, hormonal factors. So women who go on the contraceptive pill can sometimes, or if you're pregnant, you know, and there's hormonal changes. There's a specific a specific condition called melasma, which actually is associated with hormonal changes and can actually be really considered like a long-term condition that can go up and down, but can sometimes revolve when that either pregnancy completes or if they come off the pill. And then, of course, there are other things, drugs, medications such as certain anti-inflammatory drugs, antibiotics, certain drugs used in epilepsy, cancer drugs can induce pigmentation. And again, there's possibly an effect on the hormonal cascade, ultimately leading to that, or of course, inflammation. And then certain conditions, for example, Addison's disease and a whole bunch of other conditions can cause it. So there's really lots of different types. But of course, the main one, which we're all susceptible to, is UV radiation.
Yes.
And that's why we say, you know, sun is good for the soul. And yes, we do need vitamin D, but we very much do sustain cellular damage and damage to the DNA in our cells from UV radiation.
Yeah, absolutely. And so where does LED play a part in here then, in terms of phototherapy? Why do you believe that phototherapy is a good tool to work alongside this kind of condition that we see?
Yeah. I mean, you know, pigmentation is one of the it's one of the top 3 subliminal cues that indicate aging to when we look at someone.
Yeah.
And so actually it's very important to think about pigmentation, because when you address it, you give off a healthier skin. And beauty, you know, even if you're just thinking purely in terms of beauty, health is beauty. You know, we should be trying to get healthier skin, because that's what manifests as a better person. You know, that we perceive each other based on how healthy we look. That's the truth of it. So we want to do something about pigmentation on really anyone, even someone who doesn't think they've got pigmentation.
Yeah.
Actually, I always want to program that in. So really, we should be thinking about it for every single person. Then we have to think about safety. And safety is always our paramount concern. You know, you can have the most incredible treatment with 100%, it will get rid of problem A. But if 50% of people get complications, then you probably don't want to have that treatment. The nice thing about LED therapy, particularly with the Dermalux that we've got, is that we can actually treat pigmentation, which, you know, to be honest with you, majority of LED lights available, if you took all the LED devices in the world, the majority, if you include all the home devices as well, aren't really going to probably touch the pigmentation, to be frank. But when you've got a system like this, you can manage pigmentation with negligible risk. Now, just to be clear, I never say 0% risk for anything. So you've really got something with negligible risk. In fact, it's a pleasant treatment to have. You know, people sit under it, and it's so relaxing, isn't it? And it's short, it's super safe. You know, you don't have to worry about any issue. And in fact, it actually has lots of other benefits. So you might be saying, well, I'm going to put this on the pigmentation setting, but the chances are the wavelength or wavelengths that you're using are
Yes.
going to do a bunch of other things,
Yeah.
stimulate collagen. So, you know, I'm going to treat your pigmentation, but I'm really sorry, a side effect is going to be less lines and wrinkles. Well, who's going to complain? So
Yeah.
you've got quite a holistic treatment. Yes, you can play around with the settings and focus in on any particular thing like pigmentation. And so one of my, we were supporting, you know, for last year, the Portsmouth Down Syndrome Association, and one of their key volunteers, you know, just she does so much. So I wanted to gift her something, and I thought, well, you're not going to message someone and say, I'm going to give you some dermal fillers, you know, well, unless they've already asked you. So I thought, what can I give her that's not going to insult her, but actually be a really nice gift? And I gave her a course of Dermalux, 8 sessions. And we Visio scanned her before, at the beginning and at the end. And she had a break because she had, unfortunately, she had a lung, you know, spontaneous lung issue, and was in hospital. So despite all that and the stress of
Wow.
that,
Yes.
she ended up having really nice improvements. And I think we've been playing in one of our videos. We'll put it
Yes,
again.
you can see.
And
Great.
nothing, no serums, no additional things, just the LED, the Dermalux, 8 sessions, and you can see quite a remarkable improvement in her UV damage. And she herself fed back and said, my skin feels better, plumper. I've had a few comments. So yeah, what a nice thing to show that when we did nothing else, because so often we're combining it with other treatments and it's difficult to pick out what's done
Yes.
what.
Yeah.
But
Yeah.
actually, we showed with her what it can achieve on its own. So if you've got an anxious patient, you've got someone who is going to worry no matter what you do, well, you know, just give them that. You know, you don't have to worry. As a clinic owner, as a practitioner, you just can totally relax when you're putting someone
Yes.
through that.
Yeah,
Yeah.
and everyone always says it's the most used device. That's, you know, no matter who comes in, or their safety blanket, like you said, to remove risk before you go into an invasive treatment that can then have additional problems, which could cause post-inflammatory, you know, pigmentation if it's not done safely and it's not done right.
Yeah,
So,
and that's sorry, that's just as you've mentioned post-inflammatory
yeah,
hyperpigmentation. There are studies that have looked at LED therapy, even phototherapy, even in doing multiple sessions in the 1 to 2 weeks leading up to, say, a CO2 laser or something, in actually reducing the risk of subsequent post-inflammatory hyperpigmentation.
yeah,
And that's really interesting because people often focus on doing it afterwards,
yeah.
but actually in doing a short program before, will most likely, based on the evidence that we have to hand at the moment, reduce the risk of PIH in the first place.
Yeah, absolutely. And just for those that haven't seen the video yet of those before and afters, could you explain what were the difference that you noticed?
So in the lady we treated,
Yes, yeah,
yeah. So well, her, you know, UV spots, so the actual pigment spots, have reduced significantly. I mean,
yeah,
that's, you don't have to look at measurements; you can just see it. That was the main thing, and then her lines of wrinkle
yeah,
count was down.
yes,
And that's because of collagen stimulation. You know, I mean,
yes,
we talk about collagen elastin. It actually, there's a whole bunch of structural proteins in what we call the ECM, the extracellular matrix, that sits around cells, which give us that sort of, you know, that firmness, that plumpness, that elasticity to skin. And so we shouldn't hang off just those 2 words, but really you're getting stimulation of the proteins in the extracellular matrix. And of course, what certain LED wavelengths can also do is they reduce MMPs. So for the practitioners amongst you in the audience, you know, these matrix metalloproteinases, these are enzymes that actually fulfill an important function in the body and can help regulate the ECM, you know, through injury. But we know that actually LED can reduce MMP quantity, if you like, and that again, they can be responsible for degradation of collagen, elastin, and so on. So we know this is proven. There's lots and lots of good evidence. The
Yes.
key thing is, which we'll come on to later, you'll probably ask me about it, is using the right device. That's obviously the
Yes,
key thing.
exactly. Yeah, and let's move on to that then. So, you know, you worked, you've done your due diligence. You've chosen to work with Dermalax. In particular, you've got the Flex MD, which is our portable device, but you also have the TriWave MD, which is
Yeah.
our professional only device. And what was it about that device and Dermalux that met your needs? You know, in everything that you stand for, in the perfect skin, you know, the clinic.
Yeah.
What was it that met that for you?
Well, I've always said to patients, and then some of them are probably on here, and they'll have heard me say many times that I always will aim to offer the very best in something. To give you an example, we had tattoo removal going on in our clinic for years, and then I heard about pico laser, you know, being the best for tattoo removal. And our one worked, but it worked on certain colors, and
Yeah.
I just put a stop to it. And for a year and a half, 2 years, we had no tattoo removal service. This is in Portsmouth. You're not allowed to live in Portsmouth without a tattoo. And because you know, and I just stopped the service because I said, well, we're not offering the best, so I don't want to offer this. So for anything we offer, I want to think, yeah, we are doing the best for our patients, or I'll refer them somewhere else. And obviously now we've got the pico laser for anyone with a tattoo that they don't want. But I've seen Dermalux year on year on year on year since I went to the first award ceremony back in 2015, I think, win awards in the categories they're nominated for. And so I knew that name was associated, it was synonymous with LED and quality LED lights. I had another device which was fine, and we've been using LED phototherapy for some years, but it was really a nice to have, you know, kind of like here, have a bit of LED light to heal better. If someone comes in stressed, they tell the therapist, my dog died yesterday. They know our protocol is you do not treat them because the skin will react adversely. I've done a lot of posts on stress and the skin and how it's you know, we really need to be careful of what we do. What do? We don't want to send them. Their dog's just died. Sorry, you can't even have the treatment they came in for because it'll be more painful, adverse reactions, you know, lots of things. So chemical peel cancelled, you know, your painful microneedling treatment cancelled. But we'll do two things: a Selderma facial, or we'll stick them under the Dermalux, or we'll combine them. So they still get something. They get to feel nice. The inflammation's going to come down from the Dermalux because they're stressed.
Yeah.
And they get a little bit feel good factor. So I don't even know what got me onto this. Oh yeah, Dermalux. So what really sold me on it is my due diligence just showed, you know, the power was one of the key things. And the more I read the papers on LED light, I realized, you know, the power does make a difference. You know, you're delivering 240 joules with the Dermalux TriWave MD. It's even the portable device, which is probably more than 3 times stronger than any other portable device I'm aware of in the world. Okay, even compared to that, the TriWave MD is 10 times, I think, more powerful.
Yes.
So a lot of power, and we know that because even with the goggles, it's bright. You know, it's bright, and there's a powerful fan going on. And I remember when we first used it, I thought, wow, that's, you know, it's a little bit of a noisy fan, but you need it.
Yeah.
And I thought, wow, this fan's really heavy duty, and realised this because there's so much power.
Yeah.
You need that fan to deal with the heat. I'm not used to a fan being associated with LED. It just makes you realise when you've got that, you know, quality, what happens. And it's just the quality of the machine. You know, we've only bought quality technology, but I've been to shows and you play around with different machines, and you know what is quality and what isn't. And you know, you've got power. And there's lots of other little things, you know, even with obviously there's a key differences between LED and laser in terms of coherent light and polychromatic and monochromatic and all the rest of it for those science geeks in there who know. But the key thing is that with each of the wavelengths, you've got very little give, you know, a couple of nanometers either way, whereas with most LED lights, there's much more of a kind of spread. So you've got a bit more consistency that you know what you're getting, you know, whether you're using the blue, the red, the near infrared. The other key thing I love about it is that you can play around with it so much. But if you want to do the simple, I like using the idiot's version for a lot of things. I just want to press the button,
Yes.
go through a menu and
Yeah.
think acne, press that, and you're going to get what I think blue 415 and
Yes.
633 red.
Yeah.
Right? I'm impressed with my numbers,
But
right?
I am
Okay.
impressed.
Yeah, and so a new practitioner, a new therapist, you can send anyone. You decide, and they can just press a couple of buttons and it's on, and they don't need to be skilled. But at the same time, for the practitioners who do know a bit more about it, they can go in and they can go, oh no, I don't want the preset. I want to customize it. I want to put the red up, or I want to put this up.
Absolutely, yeah.
I want to stick some in eye. So the fact that you can do them all individually in various combinations. My PT had a hand injury. I know we're going off pigmentation, but I warned you this would happen. And he had a hand injury, and he said, yeah, 3 weeks, and, I've just not been able to lift full weights. I said, I'll just turn up at the clinic tomorrow, and I'll stick you on the Dermalux. And he did one session, and can't promise this with every injury, but literally the next day, he said that the pain had just gone, and it hasn't come back. And my mother had a rotator cuff issue, and it gave her some relief. I've used it for a number of injuries, but let's get back to pigmentation. Sorry, I digress.
Yes, there is so much, and like you said, you can use it for one thing, and there is a cascade of benefits that then come from it, right? So, it's not. There's so much more that it can do, and actually, even looking at the skin is just the start. There's so much more for mental health and so on.
Yeah.
But let's bring it back to pigmentation in terms of, what is the protocol that you're using at the moment for your clients? Anybody that has a Dermalux device at home, what is that protocol that you're doing, or you did with the client that you had the case study on?
Yeah, oh God, I need to look up which one we did. I think for her, we did rejuvenation.
Yes,
We did,
okay.
rejuvenation. So we weren't even doing it for pigmentation.
Yeah.
And that's the result she got.
Yes.
But there's a couple of settings, correct me if I'm wrong, there's the pigmentation setting,
Yes.
which gives you red.
Yes.
And then there's another setting which is mixed rejuvenation and pigmentation.
Absolutely,
which will give you red, and then near-infrared, which is 830, isn't it?
Yes, that's right, yes.
And for those who don't know, as you go up, you're going deeper in the skin. So, 415 blue is really working at about 1 millimeter depth. And then as you go up into the sort of 600s, you're going down to maybe 2 mil. And then as you go up to near infrared, you can go down to 3, even 4 mil. So you're getting some sort of deeper effect. And yeah, so for her, I think we did it more of a mixed protocol. In terms of what you're doing, it depends what you read and who you're speaking to, but the pigmentation setting could be used predominantly for sort of hormonally influenced pigmentation, for example, a melasma patient. And then you may move to the other settings for, most other cases like photo damage, photo-induced pigmentation. Of course, if someone's got a lot of photo damage, they have undoubtedly got a lot of collagen depletion, because UV radiation doesn't just cause the pigmentation and the age spots and the sunspots. It is also accelerating collagen breakdown. And so actually you want the NIR as well for, more of a holistic rejuvenation to the skin. I don't think you can go wrong really with LED. I think, the LED geeks are becoming an LED geek because you keep sending me all these journals to read, Melissa. But I think if you speak to an LED geek, or if you look at the papers, then I guess you'd want to be much more, no, we can only do this, do that. But I don't quote me on this, anyone, but I don't think you can go that wrong with it. I wouldn't underestimate it because it's a powerful system, but you can't really go too wrong. I will sometimes say to the team, tweak that, or just use this for now, or use that for, that wavelength. But if I didn't say it, the patient would probably still be fine, with that. And that's what's nice about the machine.
Yeah, absolutely. And in terms of sessions, I think you mentioned 8 sessions. And is that 1 a week, or did you have, 2 a week? How did that work?
Before I forget, Melissa.
Go on.
I'm going to take a photograph of you.
Ah, great.
There you go. Okay. So we typically will do, it depends on how far away the patient lives for a start, but if they can come in, we will do, we can do up to 3 sessions a week, Monday, Wednesday, Friday.
Yes.
But for that lady, there was, because she volunteers for this charity, as I said, and she's running around like, you know,
Oh,
anything. So
amazing.
we actually, we struggled to, we got her in, I think, every week, and sometimes it was 2 week gap. And then she had this hospital admission, because she effectively had something called a pneumothorax, you know, where the, you know, effectively it's not good for the lung. So she was admitted, then she came home. So she didn't even have the treatment protocol like we'd ideally.
Wow. Okay. Okay.
And
Great.
she still had some fantastic results.
Great, amazing. So she must be very pleased. I mean, definitely, if you haven't seen that video, I think it's on your page, it's on our page,
Yeah,
of you introducing today's session, and the before and afters are really impressive. So
yeah.
thank you so much for sharing that.
Can I just say briefly, I know it's about pigmentation, but you know how it is. Um, the For those who think about medical certification and FDA approval, I think, correct me if I'm wrong, but it's got FDA approval for acne, pain, wound healing, wrinkle
Yes,
reduction.
yes.
It's got, it's medically certified device for, again, acne, pain, wound healing, psoriasis, and I don't know about eczema, but you can certainly use it for eczema.
Yeah.
So there's a wide variety of conditions and skin issues and concerns that can be very safely treated with, as I say, negligible risk, pain-free, actually really nice and comfortable. You just get a very slight warm sensation. And I think the fan actually puts you to sleep. I've fallen asleep under it
You do,
a number
you
of
do.
times.
You feel like you're in Barbados somewhere.
Yeah.
Nice breeze goes through.
And
It's a lovely
for
treatment.
the practitioners out there who practice evidence-based medicine, which we should be, it's got so many studies as well, you know. And you know, when I ask you for a study, I don't know if that's a good thing or a bad thing, because you send me about 28, and then I feel obliged to read them all. I'm getting through the last one you sent me, but the fact is there's lots of, you know, it's not just award winning. There's actually some proper science behind it, which is really nice for someone like me. So I know I'm giving someone something that should really help their skin health.
Absolutely. I'm very impressed. Are you after my job with all your
No,
knowledge there?
not at all. Salderma keeps me too busy.
Now, really important to me is those that have joined the Dermalux Academy will know that I'm an absolute skincare nerd and love everything skincare. And so and I'm sure others would like to know, tell us a bit about Salderma, and also, you know, the passion behind it, but particularly the products that you use alongside for pigmentation, because they
Yeah,
also work great with a Dermalux treatment as well. I mean, I've got my, I'm away, I'm staying in Warrington. I've got my bits with me,
I love
and
seeing
this
that.
one
The
as well,
scrub.
which I absolutely love the renewal scrub. I mean, but
Yeah,
why is that so important? Because I think, of course, you need to have, you know, we've got LED as a tool for pigmentation, but for me,
yeah.
I do think that skincare is just as important. So tell us a little bit about Salderma. This is just for me, selfish reasons now.
Yeah. So Salderma, you know, I never genuinely, it was always started from a hobby, from a passion. I just heard this, someone who was educating me many years ago, 2013, I think, 12 or 13, on skin and ingredients. And I thought, wow, this woman knows a lot about ingredients I've barely heard of. I want to be like that. I want to, you know, and so I tried to learn about ingredients. Then in 2014, 15, I thought, I want a stem cell serum that I can put my name on and put it on a shelf. Interestingly, 7, 8 years later, 15 products later, I still don't have
Yes.
a stem cell serum because, as I've just been writing on the weekend for a magazine, stem cells are not what they're made out to be in products. And that is one of the things I discovered. So it was never meant to be a range beyond my clinic, because I thought all these big brands with millions, if not billions, you know, in their own labs and everything, how can I possibly have anything that we create compared to that? And what I then realized, actually, the motivations, the reasons for these brands, even if they were maybe different to start with, are now not what they are. A lot of these big brands have been bought out by the global big players, and it's essentially profit driven.
Yeah.
And so, and what I also noticed is that I'd be discovering all these ingredients and everything. I'm thinking, why is this not being used? Why is this not? Why is this version of this ingredient, which looks the same on the bottle, but is in a different form? Why is that not being used in other products? And of course, you realise that a lot of big brands out there are using technology from pre-smartphone era. You know, and I often give that analogy, you know, where I say, how many of us would give up even your iPhone 14 or whatever you're on to an iPhone 5? Very few people would be willing to do that. But we seem to be okay with using skincare that is using technology from 10, 15, 20 years ago, and people are. And it has advanced. It's advanced just as much as machines have advanced. You wouldn't want to use a laser 20 years old now. You know, you just wouldn't want to do it 15 years old because everything has advanced. So why are we doing it for skin? And what's happening is some of the ingredients, so there's a lot of misleading terminology, marketing, huge amounts. Like you may have seen examples on that private Zoom.
Yes.
And I realize more and more that there is just too much, I don't want to swear. It's just a very misleading, and the industry is just, it's about money. And so actually, if you're motivated for the right reasons, and I genuinely never did it for the money, I don't know when we'll actually make a profit because, you know, probably 10 years. But actually it's not for that. The amount of time I put into this, and I do every day, I give at least 1 hour per day even now to Saldema, if not 2 to 3, and on the weekend certainly 3 each day, is really trying to get products which are the best in their field in terms of, I can give someone a single product from the Saldema range and I expect to deliver healthier skin. We Visier scan every patient to demonstrate that, and you can often see it just on a simple photograph. Now, you're not going to, with Pigment Correct, which I've got here, you're not going to promise someone, well, I guarantee your pigmentation is going to be better, but the chances are it will be. Because, of course, it depends where in the skin that pigment is sitting. But what doctors have fed back to me is that in terms of speed of results, they've never come across a range which with one product you can get fast results. And that's the key thing. So, and also, I want simplicity. I want simplicity for my staff, for my reception team, for my practitioners. Not everyone should be expected to have phenomenal skincare knowledge, but actually if they're working in a facility where people come to them with skin concerns, or they're coming for treatment, you want to keep them safe. You want to reduce risk of post-inflammatory hyperpigmentation. Melasma patients, what a challenge to treat melasma patients, you know, even just control it. Of course, you can't cure melasma in theory, but why do we have to get complex prescription-only regimes? Why do we have to turn to devices which might actually put them at more risk of getting pigmentation? Now, of course, we use that. We have got devices in our clinic, and we've got, you know, even simple things with microneedling with certain. But the fact is that very early on, before you go into all that, you can give them a product they can take home. These are treatments. They're not serums. They're not creams. They're home treatments. And you can give something like this. This is probably the only product in our range that literally is meant for one thing, pigmentation. Yes. You know, it's got kojic acid, arbutin, Rumex occidentalis extract. They all powerful inhibitors of tyrosinase. It's got nonapeptide 1, which also inhibits MSH. MSH is melanocyte stimulating hormone that goes up in things like pregnancy, excessive sun exposure. So if I've got a patient who says, oh, you know, I'm pregnant, so I can't come in for any more treatments now, I say to them, if you take nothing, start on this because you'll reduce the risk of getting extra pigmentation, etc. And then, of course, we've got other products that you can, oh, it's pregnancy safe, by the way. But for me, I get someone on it 2 weeks before they have the device treatment to reduce risk of PIH. And if they've got any degree of pigmentation, who hasn't, it will enhance the results of anything else we're doing. And then when they get good results, say they've had pulse light, they've had LED, they've had laser, they've had chemical peels, you want to then maintain it. You know, I want my patients to get the most cost-effective regime. And yes, it might mean they have to come in less, but that's fine. And we've seen that. We've seen, you know, if you really want the best for your patients, and actually you want to give them the best treatment at home as well, not just in clinic. And then, of course, GF5, we've got to mention GF5 because we talk about patient safety, and we've got studies to show that the growth factor complex in GF5 and in Uthrostore improves skin elasticity by up to 47% in 4 weeks, reduce under-eye lines by up to 46% in 4 weeks, and crow's feet lines by up to 21%. So that's an independent lab study, but it also improves patient safety. You know, I had a message from a Morpheus 8 practitioner the other day, and she said, my patient didn't use it after Morpheus 8, 2 weeks redness, She used it after a second one. She had 1 day of redness. We've also found if we prep people on it for a few days before a treatment, a bit like the LED,
Yes.
they actually are less likely to
Yes.
get redness, adverse reactions. And so if we've got high-risk patients with very sort of ablative treatments, then the ideal combination is, well, they'll definitely get TF5, and then we'll stick them under the Dermalux as well for good measure. And we see a lot of patients from far away. They can't keep coming back for the Dermalux. We can potentially loan them the home device, which can then be collected from them. Or then if we can't, then the GF5 we've seen massively reduce healing, downtime, and risk of complication. And of course, for low budget patients, you can actually now, with LED and with the Selderma, if nothing else, they don't have to spend hundreds and hundreds on the more expensive treatments. They can still see improvements in every marker of skin aging, skin damage.
Wow.
And for me, that's amazing. We had a lady recently who came for a consultation. I gave her GF5. I said, just start prepping your skin with this, and booked her in for dermal fillers 24 days later. And we're going to be showing these photos soon. She walked into the room and it was quite obvious, and it looked like she'd had probably a couple of laser treatments on her skin. Wow. So for me, someone shouldn't have to have 5, 6, 7, 8 products to see clinically visible results. And a lot of brands do put what I call illusion ingredients in. So ingredients that will give the illusion of better skin. And people say, oh, my lines are much better with this product. But I challenge you to stop that product or those products and wait a week and then get another scan and see if your skin health has actually improved. And so when we do follow-ups in a lot of our case studies, we actually wait for them to finish their product. Then they phone up. We probably don't see them for a few days, and then we actually scan them. Because if we've actually reversed some of the signs of aging, which we can, then they will still show a really good performance. Wow. You need to suck on a clove.
Well, I know. I said that to my team earlier. I was like, oh, Dr. Dev Patel said, suck on a clove. Yes, sorry about that, guys.
No, that's fine. But it releases a local anaesthetic, which numbs the throat or breaks the cough cycle.
I need to give that a go.
All day. Yeah, forget throat lozenges. They're a waste of money, and they just put sugar in your body.
Yeah, and no more karaoke nights. Is that what you're saying?
Yeah, we'll just take it, not forever. I mean, God, who would stop karaoke? But just for a couple of weeks, right?
Yes, okay, fine. Well, you know what? I think my voice is just on its last legs now. I think what would be really good to sum up the session today is if you can share 3 really key points that we can take away from this in terms of, what treatment should we be doing? What are the key things for pigmentation really that you feel that you kind of put that package together for your clients when they come to you with this condition?
Okay. So something we haven't mentioned, well, we've mentioned sun, but sunscreen.
Yes, of course.
Make sure a good mineral sunblock. It's not about the number, it's about what's making up that effectiveness. I like zinc oxide because it's broad spectrum. You think about what factors are influencing the pigmentation or have influenced the production of pigmentation in the person in front of you. What have been the key factors? Because that will help you with your prevention strategy and also influence your treatment strategy to a degree. Then secondly, if you've got access to the Dermalux or Tri-Wave or even the portable device, try and build that into your plan, because it's even if you're doing something else alongside it, because it's a really super safe, very, very well tolerated. I mean, patients will love it. They like going under it. So, how many treatments tick all those boxes? No downtime, no risk, negligible risk, etc., etc. And then think about home topical treatments. Selderma. But no, think about topical treatments, because that's really important. And if you are going to do other things, chemical peels, certain lasers, pulse up, or any other treatments, just be aware that with all of these, you are temporarily increasing inflammation, which is fine. We use them day in, day out, even to treat pigmentation, but just be aware of that. So how can we get the benefits of that modality, but reduce the risk of actually making the patient worse. And that's where you can actually wrap that treatment around LED light to reduce that risk. And something as simple as pigment correct, you know, two very simple strategies to reduce risk. And then follow up your patient. You know, but it's important when you're treating more challenging things like melasma to warn the patient these are remitting, relapsing conditions. And even if you get on top of it, it can, through their life, come back. And there's not, you know, there's very little sometimes you can do about it except just be there for them and have a strategy in place to bring it back down again. That's kind of three things.
Amazing. I mean,
We
this has
really
gone...
need to end before Melissa
Yes,
just got off the...
I do apologise for that. How annoying. But I'm hoping it didn't take away from all this great
No,
information that
you
we've got.
look radiant, Melissa. You look
Do
radiant.
I? Okay,
Yeah,
I'll take it. I'll take it.
yeah.
Well, thank you so much. You have been amazing. I've wanted this for such a long time. I know we all have. So thank you so much. I've really
Melissa,
enjoyed
just
it.
to let you know, I mean, there were loads of questions on the on this chat. So
Yes.
I just wondered, even though we've overrun, people are welcome to leave. Oh, and you need to save the session at the end and then share it with me.
Got it. I'll do that for you. And I believe there's been somebody on there answering a couple of those questions.
Oh, they
as
have.
well,
Okay, fine. Okay,
so
good.
that's good. But we'll go through this. I've got it all recorded. So yes, any questions we can come out back to you, we will do. Yes, I better go.
Yeah,
So
no worries.
sorry, everybody.
Thanks everyone for joining.
All day.
Okay.
I've loved it. Thank you so much, and I'm sure
No
everybody
problem.
else has. Have a lovely evening, lovely rest of the week, and we will see you very soon. Thank you so much.
See you, Melissa. Thanks for the invite.
Thanks for joining us all. Bye.
Bye. Bye.
Bye. Bye.